Good afternoon, and welcome to Martin's Point. My name is Dr. Douglas Cooper, and I'm a physician in internal medicine here at Martin's Point. I'm also a member of the Maine Leadership Board of the American Lung Association. And having rid the trek across Maine a couple days ago in the pouring rain, I was thrilled to look out here and see that it's not raining. Martin's Point is an innovative, not-for-profit healthcare organization offering high-quality, affordable health care and coverage to the people of Maine and throughout New England. And we're an organization dedicated to creating a community of healthy people through authentic relationships and trust. I've been practicing here for 23 years. I teach medical students through the Tufts Maine Medical Center program. Maine physicians and health professionals have come together to mark this day as the day our nation turned a corner on climate change. Just an hour ago, the U.S. Surgeon General, Dr. Vivek Murthy, declared, "Climate change is a serious, immediate, and global threat to human health. We're not here to debate whether it's real. We're here to discuss what we're going to do about it." As the nation's doctor, the Surgeon General provides Americans with the best scientific information available on how to improve health and reduce the risk of illness and injury. There's a timeline here that you can see. Some of the highlights of Surgeon General action. In 1964, our awareness and understanding of the dangers of tobacco and smoking were forever changed by the Surgeon General's report. The same is true in 1972 with secondhand smoke, in 1987 with HIV and AIDS, in 2001 with obesity. Today's declaration by the U.S. Surgeon General marks a dramatic shift in our nation's focus and collective efforts to reduce the serious health impacts of climate change. Here in Maine, climate change is affecting our health in significant ways, contributing to high heat, ozone pollution, forest fires, and an extended pollen season, as you can see on this graphic. This all contributes to worsening lung function, acute asthma attacks, respiratory infections, heart attacks, and premature death. Children, seniors, and people with existing heart and lung conditions are at most risk. But even healthy adults who work, exercise, or recreate outdoors can be harmed. According to the CDC, Maine has one of the highest rates of asthma compared to the rest of the country. Similarly, we have one of the highest rates of lung cancer. The broader health and economic consequences of climate change are serious for Maine. Kids miss opportunity to learn when they miss school. Businesses lose productivity when workers are out sick. Families feel the impact on their wallets when they require emergency room visits, prescription drugs, and hospital admissions. This cascade of climate-related events slows growth and job creation and suppresses Maine's great potential. At Martin's Point, we're focused on keeping people healthy and out of the emergency room. Acting on climate change is critical to our success in that area. Earlier today, The Lancet, one of the world's leading medical journals, called out climate change as one of the greatest public health threats of the 21st century. We can no longer ignore the human impact of climate change. Maine physicians stand together with the Surgeon General and our international colleagues in calling for action on climate change. I'd now like to introduce Rachel Caprillion from the U.S. Department of Health and Human Services.
Thank you. Thank you, everyone. Good afternoon. Well, I am here representing U.S. Health and Human Services and Secretary Sylvia Burwell, and in fact the White House and the Surgeon General, who made this landmark statement today about climate change. Some may ask, well, climate change, except for more warm days or rising seas, how does that matter to a person's public health? It matters directly and immensely. You take just the population of people who have asthma, people who have other respiratory illnesses. Climate change is a direct correlation to the worsening of their public health and the public health of everybody else. Seasons become more extreme, heat and heat exhaustion goes way up, and most importantly, the things that are respiratory based will be acutely impacted by climate change as it continues. This is not just a world ecological crisis, it is a public health crisis, and it is something, if we do not act quickly, swiftly, and surely, will only get worse, and not in the lifetimes of our grandchildren, in our lifetimes. So, on that very happy note, I am extremely pleased to see, such commitment here in Maine and around New England at beginning to stem this tide of climate change, and the White House and USHHS is very, very grateful for your participation and your interest. Thanks.
Good afternoon. My name's Tony Owens. I'm an emergency physician. I'm one of those people, when we fail, they end up in my space. I work at Maine Medical Center and have for the last 30 years. I'm very pleased to be here today, both as a doctor, father, and a grandfather. Not only have I spent decades treating patients with heart and lung disease, and conditions made worse during periods of high heat and unhealthy air, but my youngest granddaughter suffers from asthma and has been hospitalized many times with asthma flare-ups, which are not only frightening for her to have, but they're compellingly hard as a grandparent to watch your grandchild suffer so. Let's start with what we know beyond a doubt, which is that carbon pollution and other heat-trapping gases have built up in the Earth's atmosphere, primarily from the burning of fossil fuels. As a result, we are experiencing an increase in the frequency and severity of heat waves, a worsening of air quality even in the face of stronger pollution reduction efforts, and a shift in the natural water cycle, which is causing more floods and droughts. High heat, unhealthy air, changes in rain and snow patterns, this is the face of climate change, and this is where the danger to human health begins. High heat, one of our icons there, is dangerous on its own. Just today on the way over here, I heard that 400 people have died in a heat wave in Karachi already. This is not something that's going to happen in the future. This is happening now. High heat is dangerous in its own. There's a clear data that shows mortality rates increase with heat waves. The Maine CDC has published data showing increases in expensive emergency department visits when the heat index is between 95 and 100. Warmer air also combines with gases from smokestacks and tailpipes to create more ozone pollution, which can cause shortness of breath, chest pain, wheezing and coughing, and increased asthma attacks, increased susceptibility to respiratory infections, heart attacks, and premature death. Warming temperatures are extending the pollen season, while higher concentrations of carbon dioxide are triggering greater allergenic pollen production in plants. Pollen, asthma attacks, and worsening lung conditions all go hand in hand. At the same time, heat and droughts associated with climate change are creating more conditions more favorable to forest fires, which generate immense volumes of toxic smoke, again with health consequences like asthma attacks, reduced lung function, and heart problems. The fortunate patients I've seen in the emergency department with heart trouble were often beginning a long and painful, expensive, and life-changing journey. The unfortunate ones became tragedies. Maine's location at the end of the nation's tailpipe puts us at a particular risk. Our asthma rate is one of the highest in the nation, and the costs of lung disease put a huge burden on our families, businesses, and the healthcare system. People in southern, coastal, and down east Maine get the worst of it. As you can see, as you will see, as you are seeing, the Lung Association's 2015 State of the Air report, this year York County received an F for its number of unhealthy ozone days, while Cumberland, Knox, and Hancock counties each received a C. These are troubling signs and point to the need for federal action to reduce air pollution that crosses our borders. Cleaning up sources of carbon and other harmful pollution is the best action against climate change. Coal-fired power plants are a major source of hazardous pollutants and the largest single source of carbon pollution. That's why the implementation of the Clean Power Plan, which would establish first-ever limits on carbon pollution from power plants, is a critical next step, and frankly, the lowest hanging fruit in our efforts to stem the dangerous tide of climate change. There's no longer any scientific doubt that our climate is changing. We are well beyond the place of wondering if it's real. Reducing pollution from smokestacks and tailpipes will slow the rate of climate change, improve lung health, and lower the healthcare costs related to poor air quality. Our health and economic opportunities and our quality of life all depends on our response to this challenge and the threat of climate change. I commend the Surgeon General for taking a strong stand, and I look forward to working with my colleagues in the medical community to do everything we can to ensure the health of our grandchildren and our great-grandchildren isn't threatened by something we could have prevented if only we'd responded sooner. Please join us and act on climate. Thank you.
Good afternoon. I'm Cynthia Green. I work for the Environmental Protection Agency, managing the Energy and Climate Unit there. We're in Boston and cover the 6 New England states. And I'm here to speak about climate change and public health. Yesterday, EPA released a report on climate change and the benefits of global action, a report that looks at both the physical and the economic damages of climate change in the U.S. The report outlines 2 future actions. 1, a strong action scenario in which global warming is limited to 2 degrees, and 1 with no action. In the action scenario, the health benefits are clear. Tens of thousands of lives, hundreds of billions of dollars are saved annually in the U.S. by the end of this century, and avoidance of more than 12,000 deaths from extreme heat and 57,000 deaths from poor air quality. Looking at the economics factor in New England, under a strong action scenario, we could also avoid the loss of 1/3 of the U.S. supply of oysters, scallops, and clams. The Maine Climate Futures report that was released this year indicated that there has already been an increase of 3 degrees over the past 115 years, and it is expected to continue with an increase of excessively hot days in Portland, going from 4 to 13 by 2050. For 45 years, EPA has worked to cut pollution to keep people safe, and in that time, we've dramatically cleaned up the air and the water. EPA is now taking on carbon pollution. The action plan to reduce carbon pollution includes the Clean Power Plan that was proposed last June and is expected to reduce carbon emissions from the power sector by 30% from below 2005 levels. The rules due to be finalized this summer, and with it will be long-term health benefits. The avoidance of 2,700 to 6,600 premature deaths and 140,000 to 150,000 asthma attacks by 2030. The health and climate benefits are estimated to be worth $55 billion to $93 billion in 2030, far outweighing the estimated annual costs of meeting the standards of $7.3 billion to $8.8 billion in 2030. The Clean Power Plan will protect children and other vulnerable Americans from health threats posed by a range of pollutants. It will move us towards a cleaner, more stable environment for future generations while ensuring an ongoing supply of reliable, cleaner, more efficient, and affordable power needed for economic growth. Thank you.
Good afternoon. My name is Tina Pettingill. I'm the Executive Director of the Maine Public Health Association. And along with our national partner, the American Public Health Association, we're dedicated to improving and sustaining the health and well-being of all people and all communities. So it will come as no surprise that when the Surgeon General talks, we listen. And today's statement from Surgeon General Murthy is a game changer. Climate change is a serious threat to human health, and it's imperative that we act preventatively, rather than wait for even more evidence of harm. Right now, too many people think of climate change as just an environmental issue and not a health issue. But in a March report from Yale and George Mason University, nearly 70% of adults surveyed described global warming as a major environmental issue, but again, only 44% consider it a health issue. But let's be clear, climate change is no longer about polar bears in the Arctic or dust storms on a faraway continent. Climate change is happening right here, right now, in the United States, and the people of Maine are already feeling the effects. As public health professionals, we have a critical role to play in educating the public about what's at risk. Whether it's high heat, increased ozone days, longer pollen seasons, forest fires, more deer ticks, or the stress that comes with severe weather events. We owe it to the Maine people and to the nation to act on climate change now. That means limiting the amount of heat-trapping pollution we allow into our air. It means setting common sense limits on carbon pollution from power plants, as the Clean Power Plan would do. And it means overhauling the nation's outdated ozone standards, because we have peer-reviewed medical journals and studies showing that breathing ozone is dangerous to human health, and harm occurs at levels far below what is now currently considered safe. The American Public Health Association is urging the EPA to adopt standards that are based on scientific evidence and lower ozone limits. There are cleaner ways to produce energy and keep our families and communities safe and healthy. But as climate disruptions continue and likely worsen, Maine communities need the full support of state and federal governments to ensure that we have the training, infrastructure, and resources that are needed to make these changes. By working together, we can make a difference. Thank you.
Good afternoon. My name is Dr. Loni Graham, and I am a physician who has dedicated most of my life and career to public health. I'm a board member of Physicians for Social Responsibility, and I'm also the co-chair of the Maine Medical Association's Public Health Committee. I'm really thrilled to be here with other Maine doctors, as well as our colleagues from the U.S. Department of Health and Human Services and the Environmental Protection Agency, and support the Surgeon General's call for action on climate change. I think you've heard the most important things from the other speakers. I just want to draw your attention to a couple of things. This past several weeks has been huge for climate change. At last, there is a chorus of voices at the highest level speaking out on this issue, which is global, but also affects us right here in Maine. We had the Pope's encyclical on climate change. I was deeply moved by that. I was so impressed that he took those steps. We have the Lancet Journal coming out today with a very erudite and thorough discussion, not only of the impacts of the health of climate change, but also steps that we can take that will make a real difference, not 50 years into the future, but right now. We can take action that will reduce our dependence on fossil fuels. The actions that we take that will reduce our dependence on fossil fuels will result in improvement in the health of Maine people now, not later. So this is a no-regret situation. Why not go forward with these plans to reduce our dependence on fossil fuels? I also want to mention that on the very day that the Pope's encyclical came out, Physicians for Social Responsibility published a report called Death by Degrees. And this is not our first report. 15 years ago, we published a similar report. And now, at last, we're getting a real swell of opinion on the subject. The thing that I want to point out about this report that we hoped when we published it is that it's accessible to the average Maine person. They can look at this and they can see what we're talking about. So I won't go on any further, but I do want to say that it is a wonderful couple of weeks here in Maine and nationally and internationally. And I believe that we can work together. I'm hopeful that we can all work together to make a difference. Thank you.
Well, thank you to all of our speakers for being here at Martins Point today to share in this pivotal event. And thank you to Travis Kennedy from Senator King's office for making the trip over. And thanks to the U.S. Surgeon General, Dr. Vivek Murthy, from Maine Health Professionals. Your strong statement today has left us hopeful and ready to pitch in. I'd also like to say thank you from a personal perspective. 3 of my grandparents died of lung disease. My daughter has asthma. I have asthma. I know what it's like not to be able to breathe. And I know what it's like to be able to ride in the trek across Maine and breathe. And this has made me acutely aware, personally and professionally, of lung issues and the importance of healthy air in our state. We know what's at risk, and we know there's a path forward. We need to set common sense limits on carbon pollution, especially from power plants, which is why the American Lung Association and our healthy air partners are urging the EPA to finalize a strong, clean power plan this summer. We need cleaner vehicles and fuels. We need national ozone standards that reflect the best science, because everyone has a right to know if that day's air is healthy to breathe. And we need Congress to preserve and defend the Clean Air Act from constant threats from polluters. The Clean Air Act is Maine's legacy, thanks to Senators Muskie, Cohen, and Mitchell, and it is a key to our future health, which we are confident is in good hands with Senators Collins and Senators King. Thank you for being here today, and we're happy to answer questions.